Well, I'd like to welcome everyone to the GMC April membership meeting. I'm David Lubar, Chair of the GMC and President of Lubar & Co. So we are hosting today's meeting on Zoom, and we'll be doing so again in May. As we all know, this pandemic has turned the world and our lives upside down. We are pleased to be gathering today to share current information and insights into what's happening in our city, in the state, and even beyond in our country and the world. So all of you are muted and your video screens are turned off. We will be presenting a number of speakers today, and you will have access to the Q&A box, which is, at least on your iPads, in the upper right-hand corner, to submit questions for each speaker. We do have a full agenda, so the presenters may not have time to answer all the questions. We'll do the best we can. So as our first speaker, I'd like to introduce Governor Tony Evers, the 46th governor of the state of Wisconsin. He will be accompanied by Missy Hughes, Secretary and CEO of the Wisconsin Economic Development Corp. We want to thank Governor Evers and Secretary Hughes for making the tough decisions and leading the state in terms of balancing the spread of the coronavirus with its impact on our economy. We know there are many tough decisions to come. So without further ado, let me please welcome me in turning this over to Governor Evers and Secretary Hughes.
Great, and thanks so much, David, and all of you for being with us today. I also want to thank you for inviting me to participate in this call. The last 2 weeks have been difficult for our state, to say, put it in minimal terms. Been very, very difficult, but especially for the Milwaukee area. Your communities have been particularly hard hit by COVID-19. And I share with you the sorrow we all feel at the illness and loss of so many of our family members, friends, and neighbors. So we are now into the fourth week of our Safer at Home order. And I want to thank everybody on the call for their cooperation in implementing the order so that we can continue to protect the health and safety of our residents. Now, the only way we can keep COVID from overwhelming our healthcare system is to continue to practice social distancing so that we can slow the rate of infection. So not only is this the right thing to do from a health and safety standpoint, but it's the only way we were able to get back to life as we know it. At our places of businesses, our schools, places of worship, even with our families and friends. We're starting to see some very preliminary benefits of this policy. The Department of Health Services reports that the increase in the rate of new cases is slowing somewhat. We continue to monitor this trend, but in the meantime, we need to keep our distance from each other. I know that goes against the grain for most of us here in Wisconsin. When there's a flood or a tornado or a fire, our natural instinct is to stand side by side and help each other, whether it's filling sandbags or distributing food or clearing debris from our highways. This time is obviously very, very different. Except for folks on the front lines, the most help we can give each other is to keep our distance for now. Once the danger of COVID-19 is past, that will change and we can be with each other safely again. Now, I know many of you are asking when that will happen, and the answer is we just don't know yet. We have to be safe first, so we need to put some things in place to take place first. We need to have a substantial increase in testing. We need to know who has the virus and who may have who are immune from the virus, so that when we return to being together, we're not erasing the gains we've made so far. And finally, we need to have measures in place to make sure that folks are safe when they return to work. That will likely mean new rules on social distancing in the workplace, as well as practical measures like having enough face coverings, sanitizers, and other items for everyone who needs them. The good news is that we've already started planning for the transition to get people back to work safely. In fact, I just recently was on, very recently, a few minutes ago, online with the governors from 3 other Midwest states, and we're all talking about the same thing, and we're doing planning together. So it's not just a Wisconsin thing. It's Michigan, it's Illinois, it's Minnesota, and also with us today, Secretary Hughes is working with the Department of Health Services and the Department of Workforce Development on a phased program so that businesses can get online and our people can get back to work as soon as it's safe to do so. So I'm here today to listen to your concerns so our state can provide the help Greater Milwaukee needs. It's also my pleasure to be joined with WEDC Secretary and CEO Missy Hughes, whose organization has been leading our state's efforts to help small businesses survive the initial impact of COVID and begin the road to recovery. Secretary Hughes, comments from you?
Thank you, Governor. Hi, everybody. Thank you so much for having the governor and me here today to speak with you. You know, the efforts over the last few weeks have been incredible, but one of the primary things that I've been working on is keeping the lines of communication open. And so I'm excited to be here and talk with you. And like Governor Evers, to hear your concerns and your thoughts, because as soon as we can learn what each other is going through, then we can find solutions together. Governor Evers, I'm going to take this moment to thank you for your leadership. What you've done and the hard decisions you've made have put Wisconsin on the right footing to move forward. You know, I think this multi-pronged approach that we need to have to COVID-19, an approach that's not only safer at home, but includes testing and studying the data, making sure that we have enough PPE and medical equipment, and then making sure we have the resources as we go forward to isolate and trace different cases. I really appreciate Secretary Palm is using this term of bear hugging cases as they approach, so that we can make sure we manage the next stages of COVID-19. You know, my focus is on the economic impact to the state of COVID-19, and that's also going to need a multi-pronged approach for solving these problems. And so, you know, while for the last few weeks at WEDC, we've been incredibly focused on tactical things that have been coming at us, whether it's trying to, as Governor Evers mentioned, help the small businesses with our program of SB 2020, where we were able to deploy $5 million for small grants to businesses under 20 employees. We also helped with the Small Business Administration. We helped with the whole question of essential versus non-essential and navigating that. So we've really been tactically doing things, but right now what I want to do is start to focus on a more strategic approach to economic recovery. And so what I'd like to do just for a couple of minutes is run you through what we're thinking about at WEDC and at the administration level for this. You know, first and foremost, the small businesses of Wisconsin. We have over 450,000 small businesses in Wisconsin. The majority of our businesses are defined as SBA does, as small businesses with 500 employees or less. But really, when you think about it, we have an incredible number of restaurants and bars, 13,000 bars and restaurants. We have hotels and motels and performance venues. Those are the ones that were really, you know, that first impact and have really borne the brunt of COVID-19 for Wisconsin. So thinking about those small businesses is first and foremost where my strategy goes to in the coming time. And also within that context, thinking about the micro businesses, the minority-owned businesses, and making sure that we have good outreach to them. I'm learning terms like underbanked and unbanked, and thinking about that in terms of businesses and how do we make sure that they're getting the access to the help that they need. We're also thinking about the disruption that we're seeing across industries. So, you know, traditionally we're looking at our industries of paper or manufacturing. Aerospace has taken a huge hit, but also healthcare and agriculture have been incredibly impacted by COVID-19. our healthcare systems have turned themselves over to be prepared to help with COVID, but as a result of that, they've stopped doing a lot of the work that they do on an everyday basis, whether it's mammograms or colonoscopies or hip replacements. And we need to get that back and up and running in the coming period. And we need to make sure that the healthcare industry has the resources to do that. Agriculture has been incredibly hit by, global and nationwide instances, but of course, always our dairy farmers are really taking the brunt of this, and we need to be thinking about how to help them. Another thing that we're going to be focusing on is our international and national export. Wisconsin exports $21.5 billion worth of goods every year to 200 companies. So we can only imagine what's happening to that right in this moment and how that has all just come to a grinding halt. And so we're going to need to really be thinking about that and how do we get that up and rolling again. And it's industrial machinery, electrical machinery, plastics, it's a broad breadth of products that we're exporting. And we need to be thinking about that. And we need to be thinking about the supply chain impacts of that exporting and how that's all those goods moving around and where Wisconsin is critically important in that, and and the receipt of those goods and also the export of those goods. So those are some big pieces that we're focusing on strategically as we start to think about what does it mean to get this economy rolling again. We need to be thinking about beyond this conversation of what's the date. This is a moment in time, but really we're going to be looking at a serious effort to restart our economy. And if we don't do that with a strong foot forward and making sure we've done everything that we need to do on the public health side of things, we'll stumble as we get going. And so it's really important that we think about this strategically and on a long-term basis. And the last thing I want to say as far as the strategy of getting through this, we have incredible opportunity coming out of this. Wisconsin has always been a state of innovation and entrepreneurship, and we're seeing that innovation right now where we're seeing companies pivot to PPE or making medical equipment. We have an opportunity to think about our strengths and think about how our strengths can serve ourselves and also serve the rest of the nation as we get going again. And so I'm also thinking about sharing lemonade or making lemonade out of this moment and thinking about, now that we are gonna be thinking about the future, what does that mean for Wisconsin? What are the opportunities there, and where can we use our strengths? So those are just some of the strategic ways that we're starting to look at this at WEDC. As these conversations about opening up start, we want to make sure that we have sustained effort here, that we have a sustained economy, that we're not having fits and starts. So that's why it's critically important to go back again to that public health, following the science and the data, and making sure that we're making the right choices in the short term in order to protect the long-term health of the state. With that, I will turn it back over to our folks at GMC. Again, thank you so much for having us.
Great. Well, thank you very much, Governor and Secretary Hughes. We've got a few questions that have come in. This is Julia Taylor. So the first one is from Ann Zizzo, and she said, last week we launched Share Lemonade, a website and social media channels for people to share good news stories and to find hope. The response from people and stories from businesses asking how they can help has been overwhelming. Might Share Lemonade be helpful in any regards to the state?
Yeah, absolutely. It's always good to hear. And of course, there are heroic stories going on every single day. And you see them, especially vis-a-vis the healthcare industries, but and providers. But hearing them directly from the business world, I think would be great. It would provide some positive impetus going forward.
Well, we'll connect you up with Ann then. And then I have another question from Peggy Troy, the CEO of Children's Hospital. Thank you, Governor Evers, and thanks for your leadership. Reaching more kids and families with mental and behavioral health needs has been a major priority for Children's. We continue this effort to provide access to our kids, especially during this crisis. As a result, we've rapidly deployed telehealth initiatives, including video visits. We are working with all of our community partners, especially the schools. This has come with substantial effort and cost. As you consider the state allocation of CARES funds, do you see a meaningful way to support the investment that we've made in these services during this critical time when kids that are away from school are particularly vulnerable?
Yeah, absolutely. And yes, that will be one of many priorities. But it's important. As this pandemic has moved into our state and has really taken over our lives, we've had the opportunity to try some things that we haven't done it to a great extent before. Telehealth is certainly one. Before I walked in here to have a conversation with you all, I was with the rural and agricultural community representatives from all over the state of Wisconsin. And their concern was the same, except a little different and maybe even more intense way in that obviously rural folks that are struggling, whether it's children or adults, the isolation of that is made worse because of the mental health issues are made worse because of that. And so certainly, but urban areas, suburban areas, this is a time where if people struggle to begin with, it amplifies that. And so whatever we can do to be supportive of that, we will continue to be, because I think we're learning too. Now, this is just, I read a small article, so I never take one article as necessarily a trend, but it was a telehealth, mental health provider. And he or she was talking about that, very skeptical about it at first from a provider and a professional's point of view, but they actually felt that their ability to interact even more intensely than they had before, they thought that was a real benefit. And so I'm looking forward to not only expanding that, but also using whatever we can within our power to help finance that too.
We've got a question here from Wendy Bauman from Wybick, and it's basically, how can we be more creative with synergy, the needs and businesses to address the needs we have with the virus? So she uses an example of restaurants preparing meals for food shelters, using dairy industry more through restaurants and catering to get to the one in need since schools are closed and they're huge dairy customers.
Yeah, and I'll quickly cycle back to a conversation I just had too, and I know Missy will have some comment on this one. Just with Ag and Rural Group, and one of their obvious, the dairy industry struggled mightily pre-COVID, and COVID has made their lives even more complex. And so we've actually had to work directly with supermarkets and grocery store chains and those businesses to not limit the number of the amount of dairy products that can be purchased, because on one hand you have people saying we don't have anything to do with this milk, and then we have at the retail end people saying you can only have a gallon. We have to figure that out. But in addition, there's lots of people that are struggling and just having nutritious food. And I saw a very great, you talk about a lemonade story the other day. It was on the news in the Madison area where somebody was buying significant quantities of milk from Quick Trip to give away to people that are struggling. That's a good individual supply chain. I'm not sure that's one that can be amplified and replicated across the state. So there's lots of people of goodwill. We have to find a better way to make that happen. And I'll turn it over to Missy for some thoughts. Missy, you still there?
Yep, I'm here. I just needed to unmute. As far as the dairy industry goes, obviously I worked in the dairy industry for 16 years, and it's interesting to watch because on some sides of it, the demand is incredible. Now that you have folks at home, you're finding more shopping at the grocery stores, and the shortages that the governor referred to being hard to manage there. And then on the other hand, moving away from school milk, you have a big excess. So the dairy industry is pivoting, but the question is, where can we help them? How can we help make that transition easier, and make sure that we're not dumping milk on the ground, which is really, a shame when you think about the food security issues that are going on right now. And Wendy, I know, is always thinking about innovative ways to help her businesses and keep things going. I think really understanding the nitty-gritty tactics that businesses need in order to be able to make innovative ideas or to shift gears is really critical. And that's why the networks like WEDC and the other groups around the state that can help provide those suggestions and help make that happen and grease those wheels are incredibly important at this time.
Thank you. We've got a question from John Kissinger, who's the CEO of GRAFE, and it's, I see that the legislature is meeting an extraordinary session this week. What would you expect or like to see come out of that session?
Those are two different things.
Okay.
for starters. What I expect is that the legislature and the governor's office will agree on several non-financial items, various regulations around different occupations, various kind of a regulation-based effort. And a big one for me is to eliminate the one week waiting period for unemployment insurance, and then others that have to be made so that we get on board with the increase of Medicaid opportunities for the state that exists in federal law. We have to make sure it exists in state law, and there'll be others, but there's not much money on the table, and that concerns me. It's not that I'm interested in spending every last dollar the state has, because it doesn't have much, but the bottom line is there are several pieces that are frankly missing out of the Federal CARES Act that at some point in time needs to be accessed. We need to do some things around it from Wisconsin. So we're hopeful to be continuing to work with Republican leadership to find ways to meet those needs. Clearly, childcare is one of them. We need some more resources in that area. We need resources in the agriculture areas. We need resources as it relates to nursing homes who were somewhat disadvantaged by, not disadvantaged, but not fully recognized their role in this pandemic. So there's some things that frankly are going to cost some money that we're going to continue to push the legislature on, but it's unlikely unless something extraordinary happens over the next couple of days that it'll happen now. Hopefully we'll reach some agreement after this session to bring folks back to talk about that.
Thank you very much, Governor. We've got a question from Corey Nettles from Growth Capital. Governor, thank you for your leadership across our state during the pandemic. Have you decided on the metrics you will rely on to determine when to reopen the economy?
Well, there are some metrics that we're considering, but it's for me that one of the top priorities is how we know we're at that right place, that we can open up and remove restrictions. First of all, it's not, as I think everybody on this call knows, it's not going to be flipping a switch. It's going to be predicated by some steps. But how we know we're at that place is all about the science, and that is, do we have enough testing materials? Because at some point in time, this won't be about a herd mentality of everybody in the state. It's going to be focused specifically on individuals or groups of individuals that are found to be positive as it relates to the virus. And so that's going to take, public health is going to look differently. It has to look differently. We're going to need lots of testing, and we're going to need it soon in order to have us get to a different place. We're going to need a cadre, frankly, an army of contact administrators, not administrators, but investigators, so that the person that has been identified as COVID positive, what contacts did that human being have with other people, and so that we can isolate those individuals. And then of course the resources we need to make sure that the public health systems locally and at the state level, but I'll emphasize locally, are in place. So it's more about the how than the exact metric. But in general terms, we have to bend the curve, as we've talked about many times, and we have to head a downward slope. And at that point in time, we can feel that we're making progress. We're making just a very small amount of progress. I believe it's because of our work all across the state. Wisconsinites are resilient and they're following through on social distancing. But we do have to have pieces in place so that once we kind of move from concerning ourselves with vast numbers of people that are infected by the virus, that we have a system in place to prevent this large thing from happening again. Corey, I'd love to have this over tomorrow, but at the end of the day, I don't want to be here talking with you about it a year from now. And I know that's not what you're suggesting. I'm just putting that out there. But we have to have that public health system in place so that once we stop, we feel we're at a good place at the state level, we can focus all our efforts on those individuals and the small numbers of people that will be having it pop up, so that we can immediately take care of it. That's critical. So it's more about the how than when.
Yeah, that's the scary part about the possible boomerang of this disease.
Yeah, absolutely.
Yeah. So Cecilia Gore, who's the president of the Brewers Foundation, is asking, can you speak to what can be done short-term to positively impact the African-American and minority communities that are being disproportionately impacted during this crisis?
Yeah, that's obviously the one of the scariest things about that. Actually, Lieutenant Governor Barnes and myself had a thorough briefing this morning on this issue, and what we're trying to do, and it gets back to what I was just talking about with the how. We have to get to a point where we have community folks actively involved. We need, as I said before, we need an army of people that can help find out who has been contacted by these individuals. I'm talking once again in the future, as we get beyond taking care of the statewide issue, that things are coming back to normal. We have to understand that some people that struggle mightily, you could say, well, we could call somebody up and say, oh, by the way, you had contact with Tony Evers on such and such a date. Tony was determined to be coronavirus positive. And we need to make sure that you are quarantined or do self-quarantine for 14 days. And that person says, well, by the way, I'm a single parent and I live with 3 of my kids, and we actually share this house with another family. How do you exactly expect me to self-quarantine? And that's where we need these community people that come in. We have to be hiring people to do this social work with these individuals that need to self-isolate for a while. And those people that are doing that work have to have connections with the community, have to have the ability to make sure that they're able to communicate and find the proper place for all this to happen. We need lots of those people. That's when I say that public health is going to look different in the future. It's because of that. We need to beef up that cadre of people that are working with people, not just letting them know that, oh, by the way, you need to self-isolate for 14 days, but how can I help you get to that point so that you can do that? And that's going to take a lot of help internally, hiring people from the community that have, that have those connections that maybe others don't, can overcome those barriers of trust and reliability that exists. We need to do that, and that's going to take some time to set that up.
Well, thank you, Governor. We're pretty much out of time for questions. We've got about 15 other questions here that are all, I think, very, very good questions. If you don't mind, maybe we could just forward them to you, and if you have an opportunity to respond to them, that would be great. We could share them back with those members.
Thanks, Julia. Sorry to kind of go too far, but
No.
those are important questions to answer. So Julia, thank you. David, thank you for your good help and good work, and thanks for everybody online.
Thank you very much.
You bet.
Okay, so this is David Lubar. Governor Evers and Secretary Hughes, thank you again for joining our meeting and speaking to the membership and answering these questions. We know that this is, in addition to the health risks of the pandemic, that the decision-making process of reopening the state involves a lot of judgment, and we are not naive that there's a lot of politics involved in making those decisions and executing them, and not everyone is on the same page. We want you to know that the GMC is committed to working with the parties to try and find the right balance so that we don't experience a second wave, and yet we do what is smart in terms of being able to reopen the state and minimize the impact on our economy. So that's a very difficult task to accomplish. And we know all states across the country are looking at it, each in their own unique way. But again, thank you for taking the time to meet with us and share your thoughts.
Thank you, David. Thanks everybody online.
Okay, so with that, I'd like to turn the meeting over to Denise Thomas from the Effective Communications Coach. Denise will be serving as our moderator, and will be introducing our other speakers for today and coordinating presenting questions. So Denise, it's yours.
Thank you so much, David. As mentioned, today's panel presentation will continue with a focus on COVID-19, lending insight on the many facets of our world that are challenging due to the pandemic. We have the pleasure of being joined by Dr. John Raymond, President and CEO of the Medical College of Wisconsin, Jonas Prising, Chairman and CEO of ManpowerGroup, Ryan Parsons, Attorney, Foley and Lardner, LLP, and Mary Ellen Stanek, Managing Director and Chief Investment Officer of Baird Advisors. We're going to kick off our panelist discussion with Dr. Raymond. Dr. Raymond, what are the key indicators that the virus is abating, and where are we according to those indicators?
Thanks, Denise. As many of you know, over the last 3 weeks, MMAC and MCW have been tracking the efforts of Wisconsin and our region to flatten the COVID-19 curve, and we have seen steady improvement both in the daily growth rate of new COVID-19 cases and in the calculated doubling rate. And the trends continued through yesterday at the last data set available. The reason we chose these metrics is it allows us in real time to assess how we're doing with flattening the curve and then to compare ourselves with other municipalities and countries. So as of yesterday, there were 57 new COVID-19 positive tests in Milwaukee and 128 in Wisconsin. Our daily growth rates improved again to 9.7% in both Milwaukee and Wisconsin. And recall that 3 weeks ago, the growth rate was 35%. So that's significant flattening. The doubling rates also stretched out again, improving to about 7.1 days in both Milwaukee and Wisconsin. And again, 3 weeks ago, the doubling rates was faster, or were faster in both every 3 days. So we've made tremendous progress. Now, in terms of what we've done to flatten the curve, Wisconsin ranks in the top 10 states in terms of improving where we started. So I want to say thanks to all of you and also to our government leaders who've had to make very difficult calls to help us to flatten the curve. So you've all have done tremendous work. If I could go to the next slide, please. The next slide shows new daily COVID-19 positive tests reported in Wisconsin over the last month. And as you can see, even though we've incrementally increased our testing capacity, there does appear to be a flattening of reported new cases in Wisconsin, and we think that's good news. Although not shown here, we do see the same trend in Milwaukee. But I would emphasize that we really don't know the impact of the in-person elections that were held 6 days ago, or of the relaxed social distancing that happened over the religious holidays from April 10th through 12th. And we really wouldn't expect to see an impact until at least 7 days out from those events. So we're going to need to watch that carefully, but nonetheless, we believe that there's hope that we might soon begin to see a decline in the new cases of COVID-19 here in our state. I do want to emphasize, and I think Governor Evers said this very well, we can't relax our vigilance, even as we begin to anticipate how we might begin to reopen the economy. If we could go to the next slide. With regard to reopening the economy, we should do so thoughtfully, collaboratively, and in phases with each sector of our economy. And based on an emerging national consensus, I'd like to offer 5 must-haves before we can safely reopen the economy, even in a phased fashion. And Governor Evers touched on all 5 of these earlier in the meeting. First, we must have a sustained and durable decline of new cases of COVID-19 in our state and in the affected regions. Second, we must not have exceeded the non-surge or the regular pre-COVID capacity of our health systems, especially for ICU beds and ventilators. Third, we must have adequate personal protective equipment for healthcare providers, but also for first responders and the employees in any of the sectors that we anticipate reopening. Fourth, we must have adequate testing for at least any patient with symptoms of COVID-19 and their contacts, and hopefully for a lot more than just that small population of patients. And then fifth, we have to have a robust public health surveillance capacity. And of course, as Governor Evers said, we talked about a boomerang, we need to anticipate and be prepared for recurrences, flares, and secondary waves. If I could have the next slide, please. Now, this slide shows some expectations for a near-term phased reopening of business sectors, for which the timing and pace should be informed by the non-surge capacity of the health systems, declines of new cases to acceptable levels, availability of adequate PPE, adequate testing capacity, the ability to perform rigorous surveillance, and one that I think is very important potentially for the business community is whether or not we're actually going to be able in the future to certify individuals as immune. Now, that latter one I really don't expect to happen for a month or maybe even more, depending on the validity and the availability of these new antibody-based tests. And again, all of this assumes that we're going to maintain a significant level of social distancing, at least until we have a vaccine available. That's probably 12 months down the road. If we could go to the next slide, please. So what's ahead for us? We can expect, until we have a vaccine, continued use of cloth face coverings in public when and where that's practical. We're all probably going to need to adopt alternate greetings to hugs, kisses, and handshakes. Waves, namaste, hands on heart, and other alternative greetings are probably going to be the way we do business in the future. There will be continuing limitations for in-person meetings and congregations of individuals, probably larger than 10. Special restrictions for at-risk and individual groups, limiting time in the community, for example, for individuals with pre-existing pulmonary diseases, chronic diseases like diabetes mellitus, or age restrictions. And those are things we're going to have to think about as we roll out the reopening of our economy. Special considerations for certain institutions. We need to make sure that high contact, high frequency, high density human interactions that occur in prisons, nursing homes, and dormitories are accounted for, and that we have special means of dealing with those. Probably businesses are going to have to think about hand washing upon entry, infrared scanning, temperature checks. All those things should be on the table. And then finally, we actually have to think about the long-term business implications of what we're going to be doing when we're on the other side of the COVID-19 pandemic. Very likely there's going to be more work from home, fewer shared spaces, fewer bullpens, and we're all probably going to have to rethink our need for construction projects, traffic, parking needs, et cetera. Those are all going to need to be reassessed. And what I want to stress is all this is going to require deep and thoughtful collaboration amongst business leaders, our government, the health system, and public health leaders so that we get it right. So thank you, Denise. I'll turn it back over to you.
Thank you so much, Dr. Raymond. We actually have a question from Nancy Hernandez, who's the owner of Abrazo Multi-Marketing and Communication. She asked Dr. Raymond, what are the doubling rates specifically for the hotspot areas on Milwaukee's south and north side?
Yeah, that's a great question. We actually don't see any difference in the doubling rates anywhere right now. I think, and Nancy, by the way, thank you for your good work in doing this. There was a very significant effort to reach out to the near Northwest communities, predominantly African American, and to the near South Side communities. They had the first two hotspots in Milwaukee, and I'm happy to say now that the doubling rates in all of our communities appear to be about the same, a little over 7 days.
Thank you so much. We actually have another question, Dr. Raymond. You're quite popular. I wonder why. Question is from Lauren Linder. What will be the impact of the election on the number of cases in the state, and when could we potentially see this impact?
Yeah, thanks, Lauren. We don't know. Probably the numbers tomorrow and Wednesday will tell us whether there was an impact at all. What I can say is I had some concerns about the in-person voting just in terms of the public health aspects, but what I saw was extraordinary measures taken by the polling places, the 5 in Milwaukee in particular, to make sure that people had a safe environment in which to vote, and that individuals were exercising responsible social distancing. So we'll find out tomorrow and Wednesday. To be perfectly honest with you, I'm as concerned or maybe more concerned about what happens a week from now, because I did observe a pretty significant relaxation of social distancing. Many people were having their extended family over, and there were friends that didn't live in households that were visiting in my neighborhood, and I'm sure across the region. So we really should pay attention to what happens about a week from now.
Thank you again so much, Dr. Raymond. We appreciate your leadership as well and everything that you've been contributing to our community throughout this pandemic. Thank you again. So next, we will go to Jonas Prising, who is the chairman and president of ManpowerGroup. Jonas, how are you?
Excellent. Thank you, Denise. Thanks for having me.
Oh, it is our pleasure. So our question is, what are the practices that U.S. businesses are learning from other businesses around the world regarding this pandemic?
Well, we've been very fortunate in a sense, as this very unfortunate pandemic has been ravaging the world, to be able to see this really go through the world in different ways. So we started adjusting our own business in Asia sometime around the end of January. And by mid-February, we were working from home in most of our Asian operations, which gave us a little bit of time to prepare for how we wanted to manage this when the next wave hit Europe, which inevitably it did. And all of us have read about the very difficult times that countries like Italy and Spain, now France, and lately the UK has had. Gave us even more time to prepare from a US perspective. So, I think the learnings now, of course, and you're starting to read this in the papers, you've seen that the wave has gone past Asia. And so the discussion that we've had with both the governor, with Secretary Hughes this morning, as well as Dr. Raymond, has now moved into the next phase, which is to get people safely back to work. And that is exactly the discussion now, because we're at the tail end of this wave in some ways, in parts of Europe as well. So in all European countries, you're now starting to see exactly the kind of conversations we've had this morning at the GMC about what is it that it takes to get back to work. And you're seeing some of the European countries implementing, more, less severe restrictions in terms of the businesses that are allowed to go back to work. And notably, Spain opened up some of the business this Monday. Italy will do it next week. And Austria, and Denmark, and others are starting to loosen this up. So we've had the advantage of seeing some of this wave ahead of when it started to hit our own shores, which gave us some time to prepare. But maybe since we've had a lot of discussion about, and I'm sure many of our GMC members are interested in, what does it look like when we start getting back to work? I thought that maybe share some of the views that we now have from Asia and some of the discussions that we are seeing occur and some of the liftings that are occurring in European countries as well, because it might be of interest as we reflect on both what the governor, the secretary, as well as Dr. Raymond has said. And I would say, generally speaking, it is all extremely aligned with what countries have done to successfully emerge. So first of all, the policies that different countries have implemented and that companies have had to adjust to are all based on science and facts. So the first order of the day is to limit the spread of the contagion, and we've talked about that. When reopening, the need for extensive testing, so-called contact tracing, which is, whoever gets infected can, be traced, and all of the people they were connected with, are traced as well. And the discipline then of having people stay in quarantines, those are all must-haves to be able to move forward and allow people to go back to work. From a business perspective, social distancing measures are really, really important. And so you have staggered shifts, you have 6 feet between people that are working, and you have most of the businesses that are able to operate remotely today and do so well, that don't need to congregate, that still can run the business the way they are. They stay running the business in that remote fashion, also in this time when you start loosening it up. So I think the governor, as well as Dr. Raymond, talked very clearly about it's all around the how you start loosening this up. And the last point that I'd make on this, in terms of what we're seeing across the world and how we're applying it, and then I'll talk a little bit more about what we've done here in Wisconsin and in the US as a company. The last point is that what appears to be a really strong indicator whether we're successful in flattening the curve or not at a faster or slower speed has been the behavior of individuals. In the end, this is all about people who are the carriers of the virus and people's behavior as they are adjusting to this environment. So when I step back and I look at the different countries that have implemented very hard lockdowns like France or Italy, or very, in our terms, loose lockdowns like Korea or like Sweden and other parts in Europe, you can really see that in the end, what determines the flattening of the curve is whether the population at large takes this seriously, and whether people are practicing the recommendations that the government, and in our case, the state, has suggested. And based on the discussion that we just had with both Dr. Raymond as well as the governor, and I commend him for his leadership in acting early, resolutely, and in a way that the population of Wisconsin could understand, it appears that we're acting in a way that is bringing down the curve, which of course gets us one step closer to reopening our economy in a gradual way, because I think that's going to be really important to understand as well. We are not going to see an immediate bounce back, and we're not going to get back to normal for many, many months. And none of the countries that we are working in across the world are we seeing a quick recovery and a quick return to the way it was before. It is very, very gradual. But if we go to the next slide and talk a little bit about what we've done in our company, with the heads up of where this was going and our belief that this was really a question of waves. And the next wave, as you all know, is now going to wash over Latin America in a significant way, as well as Africa. Those will be the fourth wave countries, was to set up business response teams that led centrally, but with global participation in every single country. This week, I will be talking to all of our main operations globally to gauge on where they are, but this is really an effort that's been organized that we've done to try and share best practice and give the countries and the operations in the later waves all of the benefits of the learnings and the best practices that the countries in the first waves have experienced. So how we manage to have workplaces open, how we are as an essential business still able to do it, but at the same time, run 90% of our business virtually. And we managed to accomplish that in less than in 10 days on a global basis in all of our major operations. The other part that's been extremely important, since this is all about people and keeping people safe and healthy and comfortable with working in a very dynamic and uncertain environment, is communication. So we've tripled the amount of communication that we do to all of our stakeholders, be they our associates, our employees, and our clients, to provide them both insight and transparency around what actions we're taking to keep everybody safe, as well as what actions we're taking so that we can still continue to support them for those functions and activities that continue to work and have to go to work. And that's something that's been very, very successful. And then we measure this from engagement surveys, which we conduct regularly to see how effective these communications have been and how well it's been received and what else we can do to improve it. So communication in times of crisis, in terms of outlining what it is that we do, how we're going to do it, and when we're doing it, is extremely important. And then last but not least, and this came from our experience also during the Great Recession, we practice and we try to be agile. And this was, if you'd ever see an example of how you had to be agile, this was really a time when, as an organization, we had to be agile and make very, very quick turns and adjust the business. Because as you can all see, the impact of the labor markets is very significant. So there's some industries that are very much in a declining phase right now, and there are others that are increasing. So to be able to shift the business around and to act quickly has been one of the hallmarks of what the team has accomplished in a very, very good way. And I'm delighted to say that has worked out very well in a very difficult operating environment, no doubt. So next slide, please. So we think about this as a people issue. Of course, it's a healthcare crisis which affects people. It's a crisis which affects our employees. Our employees are affected by professional issues, but they're also very much affected by personal issues in terms of their families and friends and relatives and how they need to act. So we've really focused a lot on building up a supporting infrastructure in terms of physical and financial wellness, making sure that everyone knows what they can do and what resources that we have. We're trying to use some of this time as productivity goes down due to the demand drop, that we use it for upskilling and reskilling our workforce. We're making very sure that we practice the social distancing safety measures that we know work, both in the workplace and in our personal lives, and work from home as much as possible. As you can see, that's exactly what I'm doing right now. Our investments in technology has really enabled us to do things that I never thought we'd be able to do at a speed, which has been very impressive. So the teams have managed to adopt technologies in a very rapid fashion. And it's really transformed the way we do business. Now, some of it is going to go back to the way it was once things turn back to more normal, but others are really going to fundamentally change how work gets done. And then last but not least, leveraging our foundation and our financial resources to help those that have been impacted the hardest and make sure that we make our way through this while keeping our resources engaged and able to continue to contribute when we come out on the other side. Next slide, please. So if you were to ask me, what do I see and what we were thinking, this idea that we would be coming out in a V-shaped recovery, I think is extremely unlikely. This is a situation that will affect, first of all, it's a healthcare crisis that affects people. And you've seen a drop in demand, whether you're in countries that have a hard lockdown or whether you are in countries that have a softer lockdown policy or safe stay-at-home policies of softer versions versus harder. The economic impact is very, very significant. So you don't see much of a difference between those countries that have taken very harsh measures and others that have taken less harsh measures. So the idea that demand would bounce back the minute that we feel that we're in a better place, I think is unlikely to happen as much as I would like to think it would happen. So I think we're more in for a long U recovery And hopefully the measures we've taken to protect and help the workforce is going to make sure that that return will be faster than it would have otherwise been. But in my mind, there is no doubt that this is going to be a slow, gradual recovery, and it's going to take all of 2020 and possibly some time even into 21 before we start to see a full return to the rhythm that we had before. Because people's confidence in the economy and in their own financial situation will have been shaken by this. And until we have a vaccine, everything else are mitigating measures that we take to have some form of normalcy, but it's not going to allow us to come back to full tilt the way it was before in most of the countries. So I think we have some learnings from the 2008-2009 scenario. It is going to be, we believe, a longer and slower burn recession, and eventually we will come out better because we have less fundamental issues impacting this. And then, you know, we can hopefully think of a gradual return that keeps on improving into the second half, and then, you know, making us stronger towards the latter part of the year. Because it will be required to be a disciplined return. We've seen some of the countries that have opened up their economies faster. So Singapore was a great example of a nation that was very disciplined in how they treated it and actually never went down into any form of safe at home policy, and have great technology to test and track. But even with all of those measures and the reduction in restaurant spacing and 50% capacity in movie theaters and all of that, they are now into their third resurgence wave. And so, just as Dr. Raymond said, we have to be prepared with all of these measures to be able to manage the resurgence of this. But if you have good testing and you have good tracking, you can isolate those cases and you can move on reasonably quickly without having to have this whole situation reoccur at the scale and the dimension that we've seen now. So those have been some of our experiences so far. I have to say that, you know, based on what we've seen Wisconsin do under the governor's leadership, but most of all, how the population has reacted, I feel pretty good and optimistic that, you know, under the conditions that we can think about, the fact-led and the science-driven analysis of where we are from a health care perspective, with the discipline that individuals have shown here and the great support and frankly, a lot of very painful sacrifice that a lot of us in the business community have made, in especially small and medium-sized businesses, especially in the hospitality sector. I feel good about our ability to be very disciplined in our returns so that those businesses can come up faster and in a controlled way, and, you know, get back and start to see some of the economic activity return overall and in their businesses specifically.
Thank you so much, Jonas, for your insight as well as your optimism. And I personally appreciate your endorsement of communication. So special thanks to you and your entire team at ManpowerGroup.
Thank you.
You're welcome. We will now hear from Ryan Parsons, who is attorney at Foley and Lardner LLP. Ryan, thank you so much again for being with us today. The question that we have is, what are the big hurdles for application so far with the CARES Act, and how is this impacting small businesses?
That's a great question, Denise. How much time you have?
You got 15 minutes, sir.
I could talk for hours on that piece alone. But there are so many challenges in administering a program of the size that the CARES Act has put together, with so many different aspects to it. Obviously, the gold standard program has been this Paycheck Protection Program, which is the small business loan program that includes the loan forgiveness provisions that have gotten so much attention for obvious reasons. That was set forth as a first come, first serve program with $349 billion attributed to it. And because of that aspect, because the vast majority of employers in the country are eligible for it because they have fewer than 500 employees, there's been kind of this mad rush to get the money. So that's created a number of issues. The first of which was, merely getting your banker's attention. This program is being administered through the Small Business Administration and their network of local banks. So the banks themselves have been overloaded with requests for money. So for many small employers, it's just been a matter of trying to get guidance from your banker as to how to submit the application. And then within that, there have been the application itself is extraordinarily complex because there's so many different aspects to it. One of the things that we've provided a lot of guidance on is whether employers are even eligible for the program, where you have multiple entities that are owned by the same either group or individual. So that there's been a lot of steps to navigate just to get an application completed. And then on top of that, given how fast this has been turned out, there's been additional guidance regulations put out that were released really the same day that the application process opened up. And that guidance really put restrictions on what you can do with the money. There was a list of different items and different ways you could spend the money. But the regulations that were released interpreting the legislation said that you had to spend 75% of it on employee wages. Now that made sense, of course. I mean, the purpose of the program is to keep people employed, even though they might not have as much to do, even though they're working for employers who aren't operating at full capacity. But however, having said that, people who applied for the loan thinking that they were going to spend the bulk of it on mortgage payments or rent payments, now they have to be very careful to make sure they are spending at least 75% of that money on employee wages, or they risk losing the loan forgiveness program. And then there's the issue of just getting money in people's hands. We know a lot of small businesses really are kind of going day to day at this point, and they really can use this money. And so we're waiting to see how quickly that the money can get out. I did want to note that there is discussion in Congress to expand the program, to put an additional $250 billion into the Paycheck Protection Program to avoid this kind of first come, first serve approach. We'll remain to see if it passes, but I think people are pretty optimistic that we'll get additional money for the program. Just want to touch on a couple of the other programs as well for any of our employers that are over the 500 employee threshold, who have multiple entities that together combined are over the 500 employee threshold. The mid-sized business loan program was another part of the CARES Act. We're still waiting on guidance as to how exactly the money will be administered, but there is another $500 billion available under this program. There are certain buckets set aside for a few different industries: air travel, air cargo, national security companies, but the rest is available to any companies with 500 to 10,000 employees. The terms are not nearly as beneficial as the Paycheck Protection Program. There's no loan forgiveness. There's a lot of strings attached. I believe there are 11 different conditions that employers must agree to follow if they're going to apply for this program, including some of which that last beyond the actual loan period. Having said that, it's still, for companies that are facing a liquidity crunch, it's a great opportunity to get a low interest loan. Then more recently, the Treasury Department announced the Main Street Lending Program late last week. This is a program that's partially funded by the CARES Act appropriation. So $75 billion of that $500 billion mid-size business loan program is being appropriated for the Main Street Lending Program. And so it remains to be seen how popular that will be, but there are fewer strings attached to the mid-size program. There's still some, and the interest rates will be a little bit higher, but you do have a lot of options here for companies that are facing liquidity crunch in this time period. If you go to the next slide. I just wanted to touch on a number of the different topics that we've been advising our clients most frequently over the last couple weeks. As I'm sure everyone on this call knows, this is moving, unbelievably fast. With all the new legislation, with all the new guidance we're getting, it's a different issue coming front of mind every couple of days. So I do want to touch on just a few of the things that we've seen over the last few days. The first of which is the CDC guidance that came out last Wednesday. Now, this guidance is for essential employers within the critical infrastructure industry. But what it does is it says that if you have employees that have been potentially exposed to COVID-19, but haven't tested positive, haven't showed symptoms, the CDC is saying, CDC is advising that they can remain on the job as long as they remain asymptomatic and we have sufficient social distancing measures in place. So that's new guidance and certainly inconsistent with the advice that we had previously been providing to employers, which was, if you have a positive test and you have employees around that area, that we want to have that quarantine in place. Or if you live with someone who tests positive, we want to have that quarantine in place. Now this guidance is saying mere exposure is not sufficient to force a quarantine absent further symptoms or a positive test. The thing I just want to flag about that is there are risks with following this guidance. As we know, I'm no doctor here, but from everything that I've heard and what we're hearing is that it is possible to have asymptomatic transmission of COVID-19. So just because an employee is not showing symptoms doesn't mean that the employee can't necessarily pass on the disease, the virus, to someone else. And so if that happens, then what as an employer do you do? CDC guidance isn't necessarily a defense to liability. We'll talk a little bit about some of the litigation that we're seeing and we expect to see. But as an employer, you're not necessarily off the hook just because you say, well, the CDC told me to do that. It's certainly relevant, but it's not necessarily a complete defense to liability. And then the last issue I want to flag is that in some cases, the CDC guidance appears to be on its face inconsistent with what certain states are issuing. I know Michigan, for example, is one where they have specific guidance on what you do as an employer if there is a potential exposure. And I think this guidance is inconsistent with that. There may be other states as well. So if you're operating in a multi-state jurisdiction, you need to make sure that if you want to comply with the CDC guidance, that you're also making sure that you do comply with whatever state regulations are in place as well. Next slide, please. So just to touch on a little bit of the litigation that we're seeing and that we expect to see. You may have seen in the news that Walmart recently got sued in a wrongful death lawsuit based on someone who contracted COVID apparently while at work and then subsequently died from it. So back to the prior slide, I think that's something that we're going to see more and more of is employees who contract COVID at work are going to look at the employer and say, what could you have done different? What could you have done better? You know, hindsight is going to be 20/20 on things like this. There will be probably a spate of these kind of lawsuits, and it really remains to be seen how they will play out. I think another example that it hasn't been a lawsuit yet, but that Smithfield pork processing facility in South Dakota that just shut down that made all the news. I believe they had over 200 either confirmed or suspected cases of COVID in the plant there. So the question is going to be, you know, what did they know and when did they know it? And, you know, why did it take them until 200 cases were contracted before shutting down? So there's going to be a lot of that going forward. We've already also seen employment discrimination and retaliation cases being filed. There was one, an unfair labor practice charge was filed with the NLRB relating to an Amazon employee who was allegedly opposing unsafe practices in the workplace and pro-union as well, who got fired for failing to follow a work rule. We saw another case of an employee allegedly getting fired because he also opposed something that was inconsistent with the stay-at-home order allegedly. So we're seeing a lot of that. In terms of things to come, I think we're going to see a lot of wage and hour litigation in the coming months and years. Things like unpaid work, pay for temperature tests, I think is something that we're going to see litigated coming up here pretty soon. We have hourly non-exempt employees who are working remotely for the first time, whose hours probably aren't tracked nearly as closely as they were when they're in the office or in the workplace. I think that's likely to spawn a lot of litigation. We've got a lot of employers who are changing salaries on short notice, potentially in violation of employment contracts. We've got lots of employers who are engaging in furloughs and layoffs and need to make sure that they are acting consistent with their severance plan. So a lot of different potential wage and hour litigation. We expect to see certain FMLA lawsuits based on interference with the new Families First Coronavirus Recovery Act legislation. And then the last one that we want to make sure we flag is WARN Act. So if you are a large employer and you're engaging in layoffs, make sure that you are complying with WARN. There's probably an exemption to the general rule that you have to have a 60-day notice in advance of a mass layoff or a plant closing, but you're still required under WARN to issue notice as soon as possible. So if you are engaged in layoffs or furloughs that look like they may be long-term, one more thing that you want to make sure that you're complying with. By now, next slide, please. By now, hopefully you are all aware of the expanded unemployment benefit for folks unfortunate enough to lose their job. As you know, it creates or provides an additional $600 per week in benefits in addition to the state benefit. It also allows states to extend the benefit period from 26 weeks to 39 weeks. As I note on the slide, this could create perverse incentives as you have low-wage employees who can make more in unemployment than they would be working, and even employees making decent wages that it can be a wash between unemployment or actual working. I think the even out period is about $50,000. If you make less than $50,000, you can make more in unemployment than you are while working. Now, having said that, it doesn't mean that employees can refuse work and take unemployment instead. Unemployment is available to those who claim that they are able and available to work. So if you have work for them, they can't simply refuse that and prefer to stay on unemployment. Having said that, of course, the UI office is wildly overburdened right now with all the applications that have come in. So it remains to be seen just how vigilant they are in policing unemployment applications. Finally, I just want to flag the note of the possibility of supplemental payments to employees jeopardizing unemployment. A lot of employers that I've worked with have wanted to try to make employees as whole as possible, despite the need for unemployment, despite the need to lay workers off. And in doing that, they want to try to give employees some sort of additional payment to provide some level of benefits for employees. For example, Wisconsin still has the waiting week for unemployment. So you have to be unemployed for over a week before you start being eligible for benefits. I know Governor Evers proposed legislation to eliminate that, but it still remains law for now. So we have employers that want to provide a payment or a benefit or something to employees to help them cover that waiting week. However, doing that, both in Wisconsin and other states, can jeopardize the unemployment benefit. It can count as wages that preclude unemployment. So you want to be very careful with how payments are structured in the event that you're trying to do something for employees who are laid off. And next slide, please. And lastly, just a handful of other issues that we've been touching on a lot over the last several days. The first, we've seen more and more employers go to temperature checks as a method to help try to continue operating while trying to minimize the risk of spreading COVID in the workplace. So just two notes there. One is you want to make sure that you have adequate and appropriate PPE for any person taking temperatures, as well as want to make sure that they're adequately trained in the use of the thermometer to make sure we don't have instances of false negatives, false positives. As I touched on very briefly, there is a question as to whether time spent in temperature checks is compensable time, whether you need to pay employees for time waiting in line, waiting to get a temperature check. It's an open question. I think there are really good legal arguments that it's not compensable, but that's not going to prevent a plaintiff's lawyer from taking the lawsuit that becomes a class action lawsuit. So even if we are right on the merits that it may not necessarily be compensable, there may be both litigation reasons as well as employee relation reasons to offer pay for the time spent in temperature checks. We've seen masks and face coverings. We've seen that evolve so quickly over the last few weeks. I had a client maybe 2 weeks ago have an employee request to wear a mask in the workplace that they brought in from home that the employer thought was so crazy. And now 2 weeks later, the guidance is that everyone going out in the world should be wearing masks. So things are changing very quickly. I did just want to flag the OSHA guidance that we received a couple weeks ago or late on April 3rd. And that was that you can use N95 masks that are expired. You can use them past the expiration date. You can reuse them given the risks in procuring N95 masks. However, having said that, you have to make a good faith effort to try to acquire masks, as well as the potential of using different types of masks as well. I'm going to make a pitch for all the lawyers, which is, consult counsel prior to making any important changes to employees' terms of employment or compensation. Layoffs, salary reductions, furloughs, benefit freezes, they all have legal nuances that need to be reviewed prior to implementation. Otherwise, we'll be in that litigation that we previously talked about. And then record keeping is critical. Don't lose sight of record keeping requirements in light of everything else that's going on. Now, that includes things like keeping records for tax credits that you're eligible for FFCRA leave, making sure you're complying with those record keeping requirements, to get the loan forgiveness under the CARES Act. For the deferred Social Security payments, you need to keep records on all of that and making sure you're preserving everything right now to get all the benefits that you're entitled to. And then just one last point I wanted to touch on. Dr. Raymond mentioned in this kind of slow restart that we're envisioning, the possibility that older individuals or individuals that are at risk may have a disability, maybe subject to additional restrictions into what they can do as we open up society. Of course, there are age and disability discrimination protections in our employment laws. Want to make sure that we're complying with those as well. So before you say, before we shut down the 60-plus-year-old employees and tell them they can't come to work, or anyone with a disability, obviously there are employment issues there. There's going to be a lot to work through over the next 12 to 18 months on that piece.
Ryan, thank you so much for this valuable information. Again, we appreciate your time and your insight. Thanks again.
Happy to do it. Thank you.
Our final panelist for today is Mary Ellen Stanek. Mary Ellen is the Managing Director and Chief Investment Officer of Baird Advisors. Mary, it's so great to have you on today. Our question is, what are the drivers that could bring the market back? And what impact do you believe the CARES Act will have on slowing entry into a possible recession?
Well, thank you, Denise. And one of the benefits of going last is the other presenters have laid some very valuable tracks. So just to set the stage, and it seems like a lifetime ago, but we entered this crisis in better shape than most crises. And what do I mean by that is consumers were in good shape. Their balance sheets were in good shape. We saw record employment levels when you look over the last 50 years. Banks were in good shape. And by and large, corporations were in very good shape as well. So we entered this in better shape than typically would have been the case, which is important. In order to flatten this curve, we had to induce economic self-destruction. We all worried initially about supply chain interruption, and it really was the demand destruction that quickly unfolded. Just to give, and people are going to be, when you see the headline number for second quarter GDP, right now the estimates are somewhere down 25 to down 50+%. The convention is to indicate those annualized. So those are show-stopping numbers. The speed at which and the magnitude of the decline is truly unprecedented. There is nothing in history. On the employment level, we went from record unemployment levels to record lows in unemployment to, we will quickly jump to record highs. Just in the last 3 weeks alone, 20 million people have filed for unemployment claims. We have seen, and this gets to your direct question about the CARES Act, we have seen unprecedented and quick, both in terms of timing and magnitude of a response from both the monetary authorities and the fiscal authorities. And so the question is how quickly and how long and what's going to be the impact. I want to take the monetary quickly because it's important. Why did the Fed do what they've done? And we can all debate whether, they should have taken all the moves they took, and particularly last Thursday's move. But what Jay Powell and the Fed was trying to do was stabilize the liquidity in the financial markets, particularly the shorter term markets. And you can certainly be open to criticism on that they were bailing out or helping Wall Street disproportionately to Main Street. but that quickly would have bled into the real economy, and the liquidity crisis for many would quickly turn into a solvency crisis. So they bought us some time in here. And to the CARES Act, while they have unleashed, and one of the great ironies is the 08-09 financial crisis created a number of tools that actually were used or revised that then they quickly could bring off the shelf and adapt. And then they added some more. With the CARES Act, I think the big question is how quickly, and some of the other speakers touched on this, how quickly you can get that support into the real economy, into individuals, and particularly into businesses, small businesses and medium-sized businesses, which employ an awful lot of people. Consumer confidence, if there was one thing to watch, and Dr. Raymond and the scientists have done a very good job talking about what we need to potentially start reopening. But if you look economically, confidence is critical here. Consumer confidence and business sentiment, to give you a sense for how long and how deep this is going to go. Many talk about the recovery. Is it going to be a V-shaped? That was optimistic initially. It's definitely a U. The big question is how long and how low that belly is in the U. Jonas talked about the implications being into the back half of 2020 and even into 2021. I hope that he's right and that it only tails into 2021. Confidence is taking a major hit in here. And why is that important? Because it goes right to the behaviors of the consumer. Consumers 70% of GDP, and businesses in terms of how they behave as we start to reopen the economy and start coming back, both in spending decisions, hiring decisions, CapEx decisions, etc. So what I want to, and because I know we've been going a little on the long side with, one of the things that we're mindful of as investors is, what are those things that aren't just changing in the short run and have been profoundly impacted, but what is going to change or will change for the intermediate and the long term? And some of those areas we think are certainly the trends towards globalization, which we've seen over the last several decades, versus we are going to see what people are labeling building more resiliency. And what they mean by that is not becoming so dependent on supply chains that are in other parts of the world, but building some redundancy, including some supply chains closer to home. Building more capacity closer to home. And this could end up being a positive for the US, and particularly Wisconsin with our strong manufacturing roots, carrying bigger inventories than they had in the past. Certainly commercial real estate, John Raymond talked about everybody's got to look at their construction plans. Existing commercial real estate, how many office towers and how big do they need to be? And how are those projects going to be financed going forward? That is going to change in a very significant way for quite a while. Workforce and the flexibility, the attitudes, the tools, the productivity, the flexibility, all of that has changed forever. Education, and particularly higher ed and more expensive higher education. We are all learning more about distance learning, and certainly the cost of all of that is a marginal aspect compared to current cost structures. Retail, we're going to continue to see the acceleration trends that were already underway. And then digital delivery of everything that can possibly be delivered digitally. Peggy Troy's question to the governor about telehealth and telemedicine. We are seeing adoption rates going up dramatically and far faster than anybody expected. Why? Because of the need and the urgency in the current circumstances. And then finally, the role of government. Whatever your politics, government at all levels had to step in an unprecedented way initially into this crisis. And we're certainly hopeful that as we begin to get to whatever the new normal is, one of those principles will be more private-public partnerships to help us forge the path ahead. Finally, never underestimate the resiliency of the United States and our population. We have seen tough times before. One of my favorite things that Jonas said was about communication and over communicating in here, is it really also gets to the confidence issue. If people have the information and they feel that there's that trust and transparency, they can take tough news and be part of the solution. So Denise, I would say to the CARES Act, it's a start. We do believe that there will be additional funding. You've seen huge interest in some of the smaller business loans. Certainly the banks have had challenges trying to get their infrastructure and meet that demand. And it will just be a matter of time before we start seeing it work its way through. But then at the end, it's got to also be felt in action on the part of businesses and individuals. So let me stop there.
Thank you so much, Mary Ellen. Let me see if there's any questions. I don't think there's any questions right now, but as always, we appreciate your time and your insight again. And we want to now conclude our panel discussion. I want to encourage everyone that has had an opportunity to provide questions to our distinguished panelists. Know that we will do our best to make sure that those questions are answered. So again, thank you for submitting those. And once again, thank you to all of our panelists. I'll now invite Julie back, Julia Taylor, to share GMC initiatives and updates.
Thank you, Denise. This is going to be sort of short, but I want to thank the governor and all the panel members and you, Denise. I think you gave us a lot to think about, especially given the urgency and the rapidity of this virus and how it's affected everyone's life. We've also made many changes the way we're working. You've probably noticed that we've gone to weekly newsletters. We've been sending out a lot of great videos of our members from various sectors sharing their stories of the impact of COVID-19. And we've also had to shift our initiatives to virtual education and connecting. So we found that many, as we're looking at workforce issues, many of companies are canceling their internship programs across the country. And the Commons is developing a virtual internship program for companies and colleges and universities to ensure that college students continue to have the access to corporate contacts and the challenges, the college credit, professional development opportunities, the job preparation skills, and the summer income. Because we know, however this goes, as you said, Mary Ellen, the belly of the U, we will come out of that at some point and the talent needs will be as great as ever. And so continuing to keep our students engaged with our corporations is going to be critical, as well as with our universities. We know that our member companies are looking at various ways to stay in contact with emerging talent while managing fiscally the limitation of internships and with the physical distancing that's required. We think we can help, so please contact Michael Hostad at the GMC. And in last week's e-newsletter, we asked our corporate members to participate in a survey on your plans and your ideas for your company's internship plans, and we would greatly appreciate your participation, and we'll send that back out to you. The Commons pivoted very quickly and launched Isolation Innovation, which provides college students and professionals the opportunity to come together once a week online to engage, collaborate, innovate, and learn together. So this program is every Friday morning and presents a new innovation challenge each week. It's been running now, I think, for 2 to 3 weeks, and they reach capacity every Friday with over 50 participants. So this program is available to our corporations as well as a way to engage their employees. Skill Up Milwaukee has also made virtual programming shifts by hosting office hours via video call and providing a plethora of COVID-19 business resources for the companies it works with. They made the difficult but safe decision to postpone this year's Growth Accelerator and plan to host 2 in 2021. So that's it for our program update, and I now like to invite David to close out the meeting.
Julia, thank you very much. I'd like to thank everyone on the call for calling in, and I'd like to thank all of our speakers. We learned a lot today. We had some really good insights. I think both Dr. John Raymond and Jonas Prising really emphasized that we need to continue to take this seriously. We've made good progress as a state, but it's not over with. And I know after 3 to 4 weeks of working remotely, we kind of feel like it's time to get back together, but we need to be vigilant. We need to be steadfast, and we need to continue to maintain our social distancing. I think we will be hearing from the governor in the not too distant future about his proposal for getting the state back to work. But in the meantime, everyone stay healthy, stay safe. Thank you very much. We will be meeting again on May 11th, again by Zoom. So the questions that you submitted that we weren't able to address, we will be forwarding those to the speakers, and we'll do our best to get responses to everyone. So thank you very much, and have a good rest of the day and week. Signing off.
Thanks.